I worked for many years as a professor of psychology and also had a practice in psychology, in psychotherapy. And I saw, among other things, clients who were depressed. And sometimes when they were very depressed, I would refer them to psychiatric colleagues in order to get prescriptions of antidepressants. And I assumed that those antidepressants were real drugs that were effective, and sometimes, indeed, my clients would get better. Sometimes they wouldn't. Sometimes they'd show improvement and then come back and continue psychotherapy. And when they did show improvement, I thought, as everyone did, that that was due to the chemicals in the drug. Later, I began investigating the research data. I reviewed it. I looked at the statistics. I analyzed them myself, and I discovered that almost all, if not all, of the effectiveness of antidepressant medication is really due to the placebo effect. It's not due to the chemicals in the drugs. The pharmaceutical companies know how small the difference is between the drug response and the placebo response in their clinical trials. They're aware of it. They're not surprised by it. And in fact, one of the things that they would like to do is to make their trials more effective by finding a way to identify in advance who's going to respond to placebo and then cut them out of the trials. What we are told, and have been told for years and years and years, is that depression is the result of a chemical imbalance. We know now that it is not. We've never been able to find a chemical imbalance that causes depression. So what is depression? Well, depression can be many things. One of the things that depression can be is a normal response to a terrible state of affairs, like the loss of a loved one. Sometimes that will pass with time. Sometimes it will not. Sometimes it may involve the way in which we are processing information, the way in which we are thinking about the losses in our lives. There are many, many ways to treat depression, and almost all of them seem to be as effective in the short term as antidepressant drugs, and in the long term may be more effective than using antidepressants. These include psychotherapy, and I'm just talking about the ones where we already have good data on. These include psychotherapy, acupuncture, physical exercise. These alternatives have effects that in the short term are as good as antidepressants, but seem to have lower relapse rates than you get on antidepressants over the long term. Now, it's true that the clinical trials show a small, statistically significant benefit of drug over placebo. Well, some of them do. About half of them do. Half of them don't. But here's the trick. The trick is that that benefit is so small that it's clinically insignificant. It wouldn't mean anything to the way a person feels and their functioning and their well-being in life. In fact, it's so small that doctors recognize it as no change at all. There are studies showing that exercise can be very helpful in the treatment of depression. And in the short term, exercise is as beneficial as antidepressant drugs in these studies. In the long term, if you look at what happened to people who have gotten better, did they stay better, did they get worse again, exercise seems much better than antidepressant drugs. With antidepressant drugs, over a 10-week period, over a 10-month period, close to 40% who have gotten better will relapse, will get depressed again, compared to only 8% who've gotten better through a physical exercise program. Now, antidepressants are not only prescribed to adults, they're also prescribed to children. And the tragic thing about that is, you remember, there's a small, clinically meaningless, but small, statistically significant difference between drug and placebo in the treatment of depression for adults. Most studies can't find even that small difference between drug and placebo for children and adolescents. So what they are getting when they're given antidepressants, they are being exposed to the side effects, the risks involved in the use of antidepressant medications without any benefit at all. So, although these drugs don't have very many therapeutic benefits, they do carry risks to health and side effects. Probably with the SSRIs, the most commonly prescribed type of antidepressant. SSRI stands for selective serotonin reuptake inhibitor. The most commonly experienced side effect is sexual dysfunction, treatment emergent sexual dysfunction. And that means people who before entering a study did not suffer from a sexual dysfunction. After the study, they are suffering from a sexual dysfunction after being given treatment. Now that happens at a very low rate for people who are given placebos in these studies. For people given SSRIs, the rate of sexual dysfunction, new sexual dysfunction, is between 70 and 80%. It's phenomenal. And that's just one of the side effects: nausea, gastric dysfunction. There are a range of side effects and health risks when these medications, when SSRIs are given to children, adolescents, young adults. It increases the risk of suicidal behavior, suicidal attempts, suicidal ideation. For the elderly, it increases the risk of stroke. It increases the risk of death from all causes. For women who are pregnant, it increases the risk of miscarriage. And if they don't miscarry, then it increases the risk that their child will be born with physical deformations, with autism. And for women who have taken antidepressants during the later stages of pregnancy, it increases the risk that their child will be born addicted to the antidepressant that the mother is taking. And they show that with what's called a neonatal abstinence syndrome. That is, they are born in withdrawal from the antidepressant that their mother has taken. It's the same withdrawal syndrome that is shown from the neonates, babies born to mothers who are on heroin, barbiturates, cocaine, and so on. So what should be our guidelines for choosing treatment? If somebody's depressed, what kind of treatment should they choose? Well, the first thing is, if all treatments are equally effective, and we have a range of treatment possibilities that show the same benefits as antidepressants, at least in the short term, and perhaps more benefits in the long term, when all treatments are equally effective, choose the safest. And by any measure, the antidepressants are going to be the least safe. So look at some of the validated treatments. Look at psychotherapy. Look at physical exercise. Think about them and think about which might work for you. Try one. If that doesn't work well, try another. If there's any use for antidepressants at all, and I more and more doubt that, it would be as a last resort, the last thing to try after you've tried everything else and everything else has failed. And at this point, from what I have seen of the data, at this point, I would not turn to an antidepressant under any circumstances as a new treatment.